Understanding female sexual arousal disorder. Do you know what female sexual arousal disorder is? It's a condition that is often misunderstood, yet so prevalent. It's a topic that needs to be talked about more, and today, we'll delve into it, shedding light on its symptoms, impacts, and nuances. Female sexual arousal disorder, often abbreviated as FSAD, is a persistent or recurrent inability to attain or maintain an adequate lubrication swelling response during sexual activity. This condition is part of a group of sexual disorders known as female sexual dysfunction. One of the most common symptoms of FSAD is a lack of response to sexual stimulation. This doesn't just mean physical stimulation, but also emotional and psychological stimulation. Women with FSAD often find that they don't experience the usual physical changes associated with sexual arousal, such as increased heart rate or heightened sensitivity. Another symptom is a decreased or absent sexual desire. This stands out as different from simply not being in the mood for sex from time to time. It's a consistent lack of sexual interest that persists and hinders one's sexual relationships and overall quality of life. Reduced or absent genital or non-genital sensations during sexual activity is another key symptom of FSAD. This means that even during sexual activity, there might be a lack of sensation, making the activity less enjoyable or even uncomfortable. FSAD can also manifest as a persistent or recurrent inability to maintain arousal until the completion of a sexual activity. This can result in an inability to reach orgasm or a lack of satisfaction from sexual activity. Now, it's important to note that these symptoms must cause significant distress or interpersonal difficulty to be considered FSAD. Occasional issues with arousal or desire are common and don't necessarily indicate a disorder. So, to recap, the symptoms of female sexual arousal disorder include a lack of response to sexual stimulation, decreased or absent sexual desire, reduced sensations during sexual activity, and an inability to maintain arousal until the completion of a sexual activity. Understanding these symptoms is the first step towards recognizing and addressing female sexual arousal disorder. It's a condition that can have profound effects on a woman's life, but with awareness and appropriate treatment, it can be managed effectively. Remember, no one should have to navigate the complexities of sexual health alone. So, if you or someone you know is experiencing these symptoms, it's important to consult a healthcare professional for guidance and support.